30% may be not necessary and can then cause problems, or see something on an MRI that's going to be originally innocuous, but now we have to investigate it, do a biopsy, and cause problems related to that. So expensive care does not automatically equate with good care. And the other thing is that everything we do in America is a lot more expensive compared to other developed countries. When the service is the same, the device that's used is the same. For example, look at this. This is the physician fees, the CT scanner. Of course, naturally, the tallest one is America. Average hospital cost per stay, and this is bypass surgery cost compared to the other countries. My dad recently had, I'm originally from India, and my dad came to visit me a few years ago. And he had a left knee arthritis and wanted to have an opinion. So I took him to the orthopedic colleague of mine. And he examined that, and I said, how do you feel? Do you feel it's bad enough to have surgery done? And he said, no, I'm not hurting that much. I said, okay, well, come back when you're hurting that much to have surgery. 10 years later, he says, I'm really hurting. He lives in India. I'm really hurting, but I don't want to fly. So I said, okay, well, let me fly there and get it done there. So I was there in January. India is the same thing. There are two countries when it comes to healthcare in India. Those who have money and everything is paid in cash, and those who don't have money and depend on inadequate and sporadic government healthcare. So I took him to one of the hospitals, corporate hospitals, for-profit corporate hospitals in the city. And he got admitted the day before surgery, which is unusual in America. You get admitted a few hours before the surgery. And then in a private room. And then he was operated by a surgeon trained in England. And after he had DePuy prosthesis, which is the same stuff used in many places in this country. And he was in the private room again for 4 days. And then when he went home, he had physical therapy come and take care of him for 2 weeks. All that costed me, including pre-admission testing and everything, less than $8,000. A few years ago, an average knee replacement in Texas was $160,000. It's not subpar service, it's excellent service. And he's doing very well. Everything we do here costs more than when it's used, the same thing is used in other countries. And there are too many middlemen that are making a lot of profit in medicine. And of course, too much litigation. I know there are some lawyers here, but I got to call a spade a spade. And there's a lot of fraud. And public demand, which I understand, but sometimes they demand more than they need to. And employer-provided insurance sometimes makes utilization a lot more because they're not paying as much money when an employer provides insurance as when they have to pay everything out of their own pocket. And of course, lifestyle, prevention. A lot of people are preventive oriented, but there is a significant proportion that's not. And of course, the system continues to run this way because the politicians are controlled by special interests. India is a very corrupt country, you know, but it's a barbaric, savage kind of corruption, which is like you kill, maim, true Machiavellian kind of politics, whereas American corruption is suit and tie kind of corruption, campaign financing. But they have tremendous influence on politicians and how the laws are written. Now, who's responsible for this system and benefiting from this system? Some players in every sector of healthcare delivery is responsible for this. The doctors, lawyers, pharmaceuticals, device manufacturers, hospitals. So since I'm a doctor, let me start with the doctors. Many of them are conscientious. They do the right thing. They don't want to do unnecessary things. But Institute of Medicine, as I said, it's one of the national health research wing that came up with a few months ago a study that said the same thing. $750 billion is wasted in America. And part of it is because, as I said, duplicated interventions and unnecessary interventions and ineffective interventions. And why do they do that? Why do doctors do it? There are a few reasons. One is it's called fee for service. That means the more you do it, the more you get paid. Right? A lot of them are conscientious, but sometimes When there's a question, they say, well, why not do it? I get paid. And also, a lot of them have ownership of these imaging places, like MRI or CT scanner or EKG, EMG, and all those things. So it's said that $210 billion worth of money is wasted because of this. And also, even though we think that we're one of the most advanced countries as far as research and knowledge, there's not that much clear guidelines available for what is the right thing to do, so-called evidence-based guidelines. Why? For example, let me give you an example. Sweden is the only country, being a brain and spine surgeon, let me say a little bit about spine surgery. Sweden is the only country in the world that has what's called spine registry. That means after surgery is done, a third party will call the patient and say, hey, guy, how you doing? Did it work? Was it worth it? And then they put all that information, and every year, the part of the government that deals with this research and all the spine surgeons get together and go over this information, and they don't want to use stuff that's ineffective. This country does not have it. Recently, they're trying to do that. So there are not many guidelines as far as what works the best. So sometimes they do it even though it doesn't work and go, yeah. And of course, if you ask the doctors, the first thing they say, why do you do so much? It is real. More than 80% of doctors will say, one time or the other in the past few months, I did it because I wanted to cover my, the CYA. It's a very, very big problem in America. This is a very conservative number, $190 billion. There are some, yes?
Is that in addition to the 210 you just talked about?
Yes. Yeah. This is actually, depending upon which one you read, it varies from $55 billion to $500 billion as far as defensive medicine costs in America. And pharmaceuticals, well, I don't think I have to say anything. It is the single most profitable Fortune 500 sector in the country. They make a lot of money. Why? They say that they spend a lot of money on research, but actually marketing and publicity is what they spend a lot more money on, both on doctors as well as direct advertising to patients. And they have the patent system, so even though they made, let's say, $1 billion investment and made 100% profit of $1 billion, they're not happy with 100% profit. They want 1,000% before they take the patent out and have a generic thing provided. Why? Because they can do it. They just can do it. A lot of you may be aware of Medicare Part D that was brought in by Bush a few years ago, where Medicare said, well, we're going to cover some of the medications for the elderly population, which is a good thing. But what many people don't know is that the pharmaceuticals made sure that there was a clause in that Part D law that Medicare, because of its vast number of enrollees, could really bargain for a good price, right? But the pharmaceuticals made sure that that is not done and that's prevented. Everybody talks in America when it comes to business, the economies of scale, the bargaining chip because of the economies of scale, but the pharmaceuticals made sure that Medicare never was capable of doing it. That's why? Why? Because they control the people who make these laws. Look at the drug prices. The same medication in different countries. Now, see, everybody thinks brain surgeons make a lot of money. I make a lot of money. I'm very comfortable. I can't complain. Nothing compared to any of these people. This guy, the first year, he made $18 million. And not only did control national laws, they control the international laws. So are the device manufacturers. So these pedicle screws, which is the screws that are going into the spine, I talked to one of the guys who's a representative for this spine manufacturing companies. In America, there is no restriction as far as what the price is. It could be 10 times more than the actual cost or 100 times more, as long as the public is paying, the hospitals are paying, and the employer insurances are paying, they can get away with it. Whereas Europe, the same thing costs much less. because they have limitation as far as how much they can charge. Not only that, the manufacturer directly goes to the hospital and the doctor's section. There's no middleman, there's no distributor. In America, there's a distributor, then there is a vice president of sales, then there are salespeople. Everybody is adding up. And that's the reason why it's so expensive in America. For the same screw, you know, like the ones they do in India or Korea, the same pedicle screw is 5-10 times less expensive, not because they're smaller or weaker, they're the same size screws. It's just the way the system is. And hospitals. Hospitals are also somewhat of a middleman. Many, many years ago, these were all truly not-for-profit hospitals. That means they did not make profit. If you really look at the definition of not-for-profit hospital, it says, neither the corporation nor an individual can make profit after the expenses. And if there's extra money, that has to go to the hospital or the community. Try saying that to the guys who are CEOs of the hospital these days. By the way, there was a transition around the 80s from hospital administrators to CEOs. So suddenly the hospitals became corporations. And they treat everything as a business. So it's about margin over mission. I have a hospital guy in Flint area who apparently, I thought it was $5 million, but makes $10 million a year as the CEO of a not-for-profit organization. A few years ago, Northwestern Hospital in Chicago, a not-for-profit hospital, he made $13 million in 1 year. They get the benefits from not-for-profit status. Yes, absolutely. Yeah, it's a not-for-profit, profit-oriented hospitals, you know. And absolutely, that is true. And the hospital revenues continue to go up every year. They are just making money left and right. And of course, I don't have to talk about insurance companies. They are considered to be, according to some of the real death panels. Why? What they do is that, you know, the insurance companies make money not by delivering care. They make money by not delivering care. But by getting premiums when people are healthy. That's how they make money. So what do they do when they get sick? Well, they drop you, or they have a limitation of how much they cover. And there was a guy by name, he wrote a book called Deadly Spin. This guy was part of Aetna, and I think he was in public relations. So when he hears about a story where somebody is going to be going to public or a broadcast, local broadcast news to complain about an insurance company that's not going to pay or cover certain problem, they preempt that by going to the public and spinning their story. That's different. So he eventually came out of that. And he was on Bill Moore's Journal one time when he said this. These CEOs travel in private jets and eat on gold-rimmed plates. And he couldn't take it anymore, so he came out of it and he wrote the book called Deadly Spin. So when Sarah Palin called, Obamacare was going to be a death panel, we already have death panels. That may be a little bit of hyperbole, but that is true. They make money by restricting coverage about how much you get, when you get, or by denying coverage. And another important thing that everybody should know is the number one reason for personal bankruptcies in America is a medical illness that happened to themselves or a family member. And here is the kicker. 70% of them had insurance. It's not going to be enough. Everybody thinks that, oh, I have insurance, it's going to take care of it, but that's not going to be enough. And there's a reason why private insurance, like as a hospital gown, chances are your ass is not covered, you know. And this is actually from a protest in healthcare by the healthcare now people in this. And their CEOs, man, they make a lot of money. In fact, there's an article I read in Wall Street Journal. One of the doctors who became a CEO of a private insurance company, apparently all the stock options and everything came to around $700 million or something. I said, that was a hard number for me to believe. But I'm not surprised if that's the truth. So this is Angela Bray, WellPoint, which is the biggest private insurance company. She apparently was kicked out of her position as CEO. As I was preparing the talk, I just got to know this. A few months ago, she was still CEO. Now she is not. Why? The shareholders are not happy with how much money she is making for them. So they kicked her out. And they gave her on the way out, okay, take $15 million. So apparently, that's what happened to her. But her compensation was $13 million. Now, as far as patients, I said everybody has a role, as I said, you know. In World War II is when the idea of employer-based insurance coverage came in. What happened was that FDR said that because they needed labor to produce all the military-related stuff, and there was so much demand for labor, they thought that the labor would ask for increased wages, so he put a law against increasing wages. So most of the employers said, you know, we're going to cover your health benefits. So that's how they attracted them. So that was the beginning, and one of the most important step for American healthcare of why it is the way it is. That's when employer-covered insurance started. And at one time, more than 60% to 70% of Americans, non-Medicare population Americans, were covered by that. But because of the economic downturn and loss of jobs, that number is now equal to people who are helped by Medicare and Medicaid. So they're all at the same level, 50-50. The economy has an effect on the healthcare of what kind of healthcare you get, will you have health insurance or not. Now, as far as the lifestyle, the number I just heard was that right now, $190 billion is what is said to be obesity-related problems, diabetes, hypertension, cardiac disease, strokes. And that, with the way the numbers are going up right now, could be costing close to $550 billion by 2030. And almost every state in the country will have more than 30% who are considered obese. So it's a big lifestyle issue and choice that we have to take into consideration. And this system perpetuates because, as I said, if you have money, you can buy some senators, you know. There's a fantastic YouTube clip by Bill Moyers on his Bill Moyers Journal, Public Broadcasting System, about why public option was not part of the Obamacare. It's a fantastic, you guys just Google it and see it. You know, Obama, before he was president, while he was a senator of Illinois, he believed that single-payer system is the way to go in American healthcare. And he actually said it on record. Then when he became president and came to American Medical Association the year before he created his law, he realized, politics are not going to make me achieve a single payer, so why don't I just go for public option? So he said it twice. He said it in American Medical Association talk, and that year in State of the Union speech that there will be a public option in Obamacare. But when Obamacare came in, there was no public option. Why? He entrusted Senator Max Baucus, who is the senator of Montana, Democratic senator of Montana, who is the chair of Senate Finance Committee, to get 60 senators to say yes, Obamacare. That's filibuster proof. And the only way he could get it was by taking public option off the table. Why? Because the insurance companies said, we can give you campaign money if public option is there. Because public option, if it is there, will be such a devastating competitor for private insurance companies that they're not going to survive. Well, they're not going to make as much profits, let me say this. So what happened? There's no public option. So in that's a beautiful segment that he really highlights everything in there. In that, he said that there are 5 healthcare industry lobbyists for every Congress member. And a few months before the Obamacare was created, $380 million was spent for advertising against public option and campaign contributions and lobbying for the Congress members. And of course, you know, Max Baucus apparently got a 1.5 million campaign contribution. And over 2 decades, the Senate Finance Committee members from healthcare industry got close to $50 million. Anybody recognizes this guy? This is Rick Scott. He is the poster child for Medicare fraud. He was a lawyer who got into hospital acquisition law. And you guys probably remember there's what's called an HCA company. I think it's called Hospital Corporation of America or something like that. And it had close to 100 hospitals. And somebody was trying to buy it and they couldn't. So he said, you know what? I think I can do something like this. So he apparently took some of his money, leveraged it, and bought 2 hospitals in Austin that were kind of not doing well, turned them around and just making bigger and bigger, and created a Columbia Corporation, which became so big that it bought the HCA, so that became Columbia HCA. I think in 2009, when he was the CEO of that company was fined $1.7 billion for Medicare fraud. So the board said, dude, you're out of here. But take apparently $100 million was given to him. And guess what happened to him? No, he became the Republican governor of Florida. He's right now the Republican governor of Florida. And he wants to revamp Medicaid. So fraud is also a problem. So the reason American healthcare is so expensive but does not achieve what it's supposed to achieve is because it is one of the most unintegrated or uncoordinated. That is, a patient goes to one doctor, he does something or she does something, then he goes to another doctor or she goes to another doctor. There may be duplication of it because they're not talking to one another about what's done, what was already ruled out. So it's one of the most unintegrated. In Japan, if you go to a doctor, you have a card, and the moment you go there, put the card in the computer, it tells you everything up to date, the last doctor's visit, what's been done. So whatever they do that day, they upgrade it, and then next doctor, that doctor knows what's been done. So it is one of the most integrated systems, but we're not. You were absolutely right. VA, you were absolutely right. VA is at the cutting edge. A lot of people don't believe it. They are the ones to create electronic health records in America. We can go to that in a second, but you're right. VA does it. Other than VA, it's an unintegrated, it's a highly commercialized. So if one word you have to explain the adjective for American healthcare delivery, it is one of the most commercialized system that's profit-driven and perpetuated by a corrupt political system. You know Bill Frist, right? He was Senate majority leader or minority leader, I think, at one time. And he made a lot of money as owner of hospital. He was a cardiac surgeon. So they asked him, how are you going to cover the uninsured? And he said, yeah, with a sheet. Because the for-profit systems are not, they're interested in money rather than quality, although there is some extent. Can we really fix this healthcare in America? Well, we can do reverse of everything I just said, right? That is, doctors doing really conscientious thing, you know, eliminate the middleman, make sure you have cost controls of all the devices and pharmaceuticals and all that stuff. But it's not that easy. And Romney did try it. He tried it. And this is the thing. It's been very helpful. 2007 is when he created Romney Care with the help of a guy by name Jonathan Gruber, who was the architect of Romney Care, economics professor in MIT, Massachusetts Institute of Technology. Massachusetts is the only state that has 100% coverage of children, 98.5% of coverage of some kind of adults. Now, he was so proud of his and also he was, you know, he was talking about I can bring the bipartisan politicians together. He actually did it. When he signed this bill, the two people that were standing next to him was Ted Kennedy, the liberal among liberals of Democratic senators, and a representative from Heritage Institute, Heritage Foundation. They were next to one another. And apparently, he was so proud of this that when they asked him to pose for creating the governor's portrait for the Assembly Hall or their Congress, he made sure that there was a blue book with caduceus on it because he was so proud of his achievement. But the moment he started realizing I'm going to be contesting as a Republican nominee. And there was an individual mandate in there. And all the Republicans and conservatives said, well, we're not going to want government tell us what to do and force us to buy insurance or penalized if we're not responsible and buy it. So he had to distance himself from it, even though it's been very useful. And that lady that I showed the picture, she was so thankful for Romney Care. But politics always trump. And Obama did the same thing. Obama took a page from Romney Care, and Jonathan Gruber is the same guy who helped him create this. So all the people who didn't say too many things about Romney Care were just out of control with Obamacare. And they said, oh, what's the difference? There's a difference between Romney Care. Is everybody 18 years old here? Right? Okay. So there's going to be a language here that I have to warn you about. So they asked Jonathan Gruber. I said, wait a minute, dude. You know, the individual mandate from Romney Care is different from individual mandate in Obamacare. That's why we had Obamacare. He said, no, it's the same thing. Is exactly what he said. That's what he said. But people were outraged about Obamacare, even though it's helpful in Massachusetts, was done by a Republican governor. And they said, oh, you're going to ration me this. Look at me. What happened? I love this picture. But there are good things about Obamacare. I'm not saying that it is the panacea and the cure for all the ills ailing American healthcare, but intention is good. Intention is to improve access to as many Americans as possible. And if everything is implemented, there'll be 30 million added to some kind of insurance. And everybody who is 21 to 26 are so shouting out to Obama for being able to stay on their parents' insurance. And he said no pre-existing condition restrictions for private insurance or individual insurance. Right now, many companies say, oh, you coughed a year ago, you're not eligible, right? They can do it. And also there's no restriction as far as the limitation. And you know, it's too bad that the government has to tell these people to do it. They shouldn't be. They should have been doing it on their own. Now, so